So this discussion is going to focus on stimulant drugs. Now we're going to kind of limit our talk to certain ones. As you'll see, we're going to also have a class topic covering nutritional supplements and also street drugs. So we'll be talking about drugs that probably have some similar properties within those discussions, but for now we're just going to kind of focus on some particular stimulants and kind of how they work, look at some of the more common stimulants that get used. So to define a stimulant, it's any agent that temporarily increases functional activity. So we're going to be looking at, and there's various types of stimulants. There are some that are prescription, there are some that are over the counter, there are some that aren't even directly in drug form. I mean, one of the most popular beverages in the world, coffee, is known for its stimulant effects because of caffeine. So we know that there are other prescription drugs, some of which we won't be, again, talking about here, that utilize stimulant-based properties to stimulate the CNS. For instance, Ritalin, an ADHD drug, utilizes stimulants in it. So the category of drugs that produce stimulation of the sympathetic nervous system is known as sympathomimetics. So any drug that stimulates that branch of the nervous system is known as a sympathomimetic. Again, we're going to be looking at very focused particular types of stimulants in this chapter. When we get into, again, the street drugs and things like that, we'll be looking at some other types as well. The first stimulant we're going to look at is ephedra, and ephedra comes from the mua huang plant, and that plant is basically used to create two different types of stimulants. You have ephedra and pseudoephedrine. So both of these are sympathomimetics. They stimulate the sympathetic nervous system, again, which is your fight or flight mechanism. The ephedra gets removed in process, and it basically forms what's known as ephedrine. You've probably seen, or at least at one time, was a very popular weight loss drug. The pseudoephedrine is the isomer form of ephedra, and that's what you see in your over-the-counter oral decongestants. So they're very effective at producing vasoconstriction in the blood vessels of the nose, and that's what produces the decongestant effect. The unfortunate thing is that, as your book describes, that pseudoephedrine is now used to produce the illegal production of methamphetamine. So that's part of the reason why when you go to a drugstore and you go to buy an over-the-counter oral decongestant, you have to show them your ID because they want to make sure that people are not utilizing it for these illegal purposes. The interesting thing is, again, as I was saying, ephedra used to be a popular weight loss drug. However, it was banned for over-the-counter sale back in about 2004. So it is no longer able to be put in over-the-counter weight loss drugs. So what we're going to look at is now what effects do we have. So the effects that you're looking at with these drugs is that, again, it's sympathetic effects. So what happens is you get dilation of the bronchial mucosa, contraction of the blood vessels in the nasal mucosa, and also an increase in blood pressure are some of the effects that you have from taking these types of drugs. So the pharmacokinetics and pharmacodynamics of ephedra. First, the pharmacokinetics. So we look at the peak plasma levels, so in other words, the highest levels in the blood at about 4 hours. For natural, for synthetic versions, it's a little shorter. So the synthetic versions act a little faster, usually in about an hour. It does get excreted through the urine. The pharmacodynamics, again, it is a sympathomimetic, and they used to combine both caffeine and aspirin can potentiate the effects of ephedra. So they're synergistic, and they can make the effects much more pronounced. It was very popular back when you could buy this drug over the counter to combine it with caffeine. So they used to actually have caffeine and ephedra mixtures. However, they attributed a lot of a lot of deaths of people taking these drugs to that combination. So that kind of prompted the ban on the use of ephedra in over-the-counter preparations. Obviously, people can still get this drug illegally, and it is a banned substance. So again, as I said, the most common thing ephedra was used for is in weight loss drugs. It's a very popular component of weight loss drugs. However, it was banned for sale, and they ended up determining that the potential negative health effects from it kind of outweighed any benefit. So it was used in a lot of those. It was questionable whether or not you can get performance enhancement benefits from it. Obviously, we look at stimulants as having a powerful effect and being able to help improve performance. So we know that it's effective as a CNS stimulant. However, whether or not the ephedra itself is beneficial on athletic performance is still kind of in question. So, you know, as far as an over-the-counter supplement, even when it was legal, it was questionable whether or not it actually produced results. Again, the pseudoephedrine is what gets utilized in decongestants and cold medicines. However, as I said earlier, there have been regulations put in place as far as the sale of those types of over-the-counter drugs because of the illegal production of methamphetamine. So here are some of your potential adverse effects of ephedra. So, and again, you think about, again, it's stimulation of the sympathetic nervous system. So all of those things, insomnia, nervousness, stomach upset, dry mouth, tremors, agitation, possible spontaneous abortions, heart attack, stroke, and obviously the most extreme situations being death. So having been through the adverse effects, we look at, you know, typical individuals. Again, you can't buy ephedra legally anymore, but just to kind of look at some potential problems in people that had prior health conditions or people who were typically even more at risk to have issues if they were taking the ephedra. So people with cardiovascular disease, or had, you know, angina, chest, you know, the chest pain associated with cardiac issues, people with thyroid disorders, people who already had elevated blood pressure, people who took MAO inhibitors, people with enlarged prostates, or people on alpha-2 blockers, all would have very pronounced effects with taking ephedra. So if people with these conditions that had these issues were utilizing over-the-counter ephedra as a weight loss drug, for instance, or just even as a general stimulant, these would be individuals who would possibly have a prior health condition exacerbated by use of the drug. Caffeine is another stimulant. It's one of the most popular drugs, probably one of the most commonly consumed drugs. As I had said earlier, coffee is pretty much the most popular beverage in the world, and actually recent studies have shown some other benefits of just consuming coffee aside from the caffeine effects. But the caffeine in coffee or just caffeine in general, is something that can be utilized and actually shows potential for a wide range of activities. Definitely one of the, I would say, most effective performance enhancers if you want to look at it from a supplementation standpoint. It falls under the xanthine class of drugs, and again, what that's noted for is, again, the actions of this drug as a CNS stimulant. So more than likely, most individuals will consume some form of caffeine. If you look at various products, there's varying amounts of caffeine in different types of drinks. So just some examples here of some serving sizes and caffeine content in various things. And I also have up here the over-the-counter drugs that get utilized for stimulants, your no-dose and Vivarin, about 100 to 200 milligrams. So you see in those drugs, you're basically getting about the same amount you would get in approximately 2 cups of coffee potentially. So just some different things so you can get. Obviously, there's various types of caffeinated beverages out there. We know all the different types of energy drinks, your Red Bull and Monster drinks. So the key with this is if, and we'll talk about this later on as well, if an athlete is going to use caffeine as a supplement, to their training and athletic endeavors, they have to take into consideration things like, again, if they, do they drink soda during the day? Okay, if you're going to use caffeine as a nutritional supplement to enhance performance, make sure you're watching how much you consume over the course of the day. In looking at the pharmacodynamics of caffeine, we're essentially looking at what are some of the reasons why caffeine acts as a stimulant. So some different mechanisms proposed as to how caffeine works. The first is the increase in fat oxidation. So the idea here is there's an increase in free fatty acids in the bloodstream, and what this essentially does is allows the body to mobilize these fat stores and use them as energy. And the idea here, particularly as it relates more for the benefits in aerobic exercise, is the fact that it allows the body to utilize the fat stores as energy and spares the muscle glycogen. So you actually will use less muscle glycogen for energy and have that, for instance, in a situation where you have like a longer duration aerobic event. It allows you to use those muscle glycogen stores later on in the event. Another reason why, or another proposed theory, is that it's an antagonist to adenosine receptors and also increases the amount of circulating dopamine. So one of the proposed reasons with this, in looking at the effects on the neurologic system, is that you get the caffeine binding to the adenosine receptors, and what that does is it prevents the receptors from attaching to adenosine. Okay, adenosine is basically, at the end of the day when you're starting to feel tired, adenosine the amount of adenosine is starting to increase, and what that does is as they start to fill the receptors, that's what essentially allows you to eventually rest and want to go to sleep. Well, what caffeine does is it attaches to those and has the exact opposite effect. So it will decrease the drowsiness that you'll start to feel as you're starting to get more and more tired. Another theory or another concept is the increase in calcium release. So what the idea here is that the caffeine consumption will increase the amount of calcium that gets released, which is going to be essential to muscle contraction. So by increasing the amount of circulating calcium in the body, it will allow for much stronger and much more efficient muscle contraction. So to kind of summarize the pharmacodynamics, you have, again, the general theories. So these three theories relate back to the proposed mechanisms as to how caffeine works to prevent somebody from getting tired or feeling tired. So again, you have the metabolic theory. The metabolic theory refers back to the increase in free fatty acids. Again, sparing muscle glycogen. Now you'll read in your textbook, they'll talk about how it kind of really only explains the benefit of caffeine as it relates to more aerobic-based activity. Part of the reason for that is because it takes a lot more oxygen to be able to get the energy from the fats that you're using. Okay, when you look at exercise physiology, fat has a lot of energy in it. Each gram of fat has a lot of energy, but the problem is it takes a lot of oxygen to kind of liberate and use that energy. So that's where they're basically saying that, probably that theory would only really apply to the benefits that it has with aerobic exercise, basically because aerobic exercise, there's plentiful oxygen and you'll have enough oxygen for your other cells to be able to use. Your neurologic theory relates to the concept of relating to the neurotransmitter adenosine. So again, it will act as an antagonist to the adenosine receptors and not allow the CNS to basically promote drowsiness by a buildup of that neurotransmitter adenosine. And then the muscular theory relates to the effect that the calcium had, the effect of the increase in the circulation of calcium throughout the body. So what it basically does is caffeine will increase the calcium release. And again, if you go back to how a muscle contracts, the initial part of it is calcium gets released from the sarcoplasmic reticulum in the muscle, and that will then allow for the muscle to contract over a longer period of time. So you get much more efficient muscle contraction related to that. Now again, much like everything else, caffeine for the most part is when used responsibly and appropriately is relatively safe, but again, because it is a stimulant, there are some potential adverse side effects for people. So again, your common things you would think about with a stimulant, the anxiety, headaches. Headaches are actually also a withdrawal symptom for people who are used to consuming caffeine. If they try to eliminate caffeine from their caffeine consumption from their everyday diet, they'll actually get headache as a withdrawal symptom as well. But it could be a potential adverse effect if consumed too much. It can potentially block deep sleep, particularly as it relates to consuming caffeine too late in the day, which again would make sense based upon the physiology we talked about earlier with its effects on adenosine. Again, not for pregnant or breastfeeding women, and that's just potentially because of the transmission to the baby. Again, massive doses, and then the interesting thing about caffeine, we're going to talk about the ergogenic effects. There's kind of a threshold or a ceiling at which caffeine will produce beneficial effects. So it's one of those ideas that the more is not better concept definitely applies with caffeine. So definitely some cardiac issues and other neurologic side effects that could occur when caffeine is taken in too high of a dose. The one interesting point to make note of, caffeine is not a diuretic. It's still kind of out there, and people try to scare individuals from using caffeine, claiming that it's going to dehydrate them and it's a diuretic. It is not a diuretic. A lot of studies have been done on this. It does not affect fluid balance in any way. And usually the common pushback to this is, well, why when people drink their coffee in the morning are they, running to the bathroom? And the simple explanation for that is the fact that most people, when they have coffee in the morning, don't have one cup of coffee. Usually people will have multiple cups of coffee, or if they stop somewhere to get a coffee, they're usually not buying the small or the medium. I mean, you usually see when people are coming, people are walking into the office with their coffee, it's usually the 24-ounce large. So the common theme with that is if you're drinking more fluid, you're going to go to the bathroom more. Okay, you're going to urinate more. So that's usually what you see. So again, most people when they consume, we commonly associate this with coffee, is that they just consume large amounts of fluid, and that's the reason why they're going to the bathroom. So when looking at the ergogenic benefits, if somebody is looking to get ergogenic benefits from caffeine, a good starting point is you look at 3 to 6 milligrams per kilogram of body weight. Again, more than this will not be better and actually will start to produce adverse effects. It's interesting when you look at the drug testing rules in sports, the level of caffeine you have to have in your body to produce an illegal amount of caffeine is actually beyond the limit of what it takes to get a benefit from the caffeine. So again, more is not better. So it's important to kind of talk about this with your athletes, if you have an athlete who wants to use caffeine as an ergogenic supplement. There is also potentially some benefits. They were looking at post-workout, so we commonly think of, well, it's a great pre-workout supplement. They were starting to look at post-workout, are there any benefits to consuming caffeine? And the idea would be there is that the potential for caffeine to increase the uptake of glucose after a workout, which then would help promote recovery. So it's still questionable. I haven't seen any research come out confirming that aspect yet. It may be out there and I just haven't seen it, but there is the potential for there to be some post-workout benefits to your caffeine supplementation. So some other points about caffeine. It is on the banned substance list. Now, as your book talks about this, it refers to it as a restricted substance because it's not totally banned. So just because an athlete has caffeine in their body, they're not going to be disqualified. But it's interesting again to note. So I have up here at what level it's banned at. So 15 micrograms per milliliter. Through the NCAA and the IOC is 12 micrograms per milliliter. But as I have up here, almost in order. Now again, this is kind of a general guideline because everybody metabolizes caffeine at a different rate. But for somebody to test positive at the IOC, which is the Olympic Committee, the Olympic Committee's drug policies, in order for somebody to test positive, they would basically have to consume 600 to 800 milligrams of coffee within 30 minutes of the test. So go back up, or you can even look in your textbook, look at the average caffeine amount in your servings of caffeine based upon how you're taking it in. That's a lot of caffeine, okay? So, and again, that's a general number because, especially for the time frame, because again, most people are gonna, everyone's metabolism is gonna be slightly different, but it's something to look at in relation to the caffeine consumption. So again, the ergogenic levels of caffeine are much less than this. When you're looking at what are the benefits. If you look at page 175, under the what to tell the athlete in your textbook, they kind of talk about this a little bit. Probably a good thing to kind of read in relation to athletes. Now, when we look at the habitual versus the non-habitual user, so they were questioning whether or not there would be a benefit in the habitual caffeine user, so in other words, the person that uses it at any point in time. A lot of your early results of studies showed that people who consume caffeine a lot didn't experience a lot of the benefits of caffeine consumption, but studies that came out more recently have been starting to show that for instance, there has been an increase in muscle contraction in both habitual and non-habitual users. So it's something that definitely requires more research, but the question becomes, could somebody who consumes caffeine more regularly get a benefit from it? What they're finding is that it does appear to be ergogenic to both regular users and non-users of caffeine. Obviously, people who aren't used to consuming caffeine may experience a greater effect just because their bodies aren't used to it, but the ergogenic effect seems to be pretty common to both. And then in relation to a tablet form, like say a Vivarin versus caffeine in a beverage, tablets and capsules do appear to be slightly more effective in producing the stimulant effects. They're not really sure why. I mean, it's just proposed that obviously it's probably it's more readily available for the body to utilize. Again, not a proven aspect of it, but just from thinking about the fact that if you're consuming caffeine in a pill versus caffeine in a beverage, beverages usually have other things in them. I mean, even coffee itself, it's not just caffeine in a pure form to break down. It has other things in it. So, but the tablet form is found to be more effective and will have a faster effect on the person. Again, it doesn't mean that they can't consume, individuals can't consume caffeine in beverages. And again, the other benefit you look at to consuming it in a beverage is at least you're getting then the fluid portion of the drink as well. So the ATC role, so just something to look at. This isn't per se an assignment, but when you look at the athletic trainer's role in this. So what do you tell athletes about caffeine? And I would say this, we're going to talk about nutritional supplements in a future chapter and in a future discussion, but be honest with your athletes. Again, to just say, well, caffeine's bad for you when we know it's not inherently bad for you. If you aren't honest with your athletes, that they're going to find other resources, and then they'll probably end up using it the wrong way anyway. Okay, it's kind of something that I've found with supplements. So just be honest. And if they have health conditions to where caffeine might not be the best route for them to go, tell them that. Again, it's your role to educate them. It's not your role to take a random stance on a supplement and tell them not to do it just because you think it's bad for you. And again, it may depend on the setting. In the high school setting, it may be a little dicier to start giving, blanket recommendations on supplements. But again, use your, read research, understand the fact that, when taking in the smaller amounts for the ergogenic benefit, most athletes aren't going to have a problem. The other thing to suggest is it's probably not the best idea if an athlete doesn't regularly consume caffeine or use it for ergogenic purposes. It's probably not the best idea to use it right before a contest. It would probably be a better idea to trial it before a practice. This way here, if they do potentially have some type of issue, then at least you could determine that ahead of time. But again, making false statements, for instance, saying, well, it's a diuretic. There's even a part of your textbook that says it's a diuretic. Your book was published a few years back. But, studies have come out showing that it does not produce a diuretic effect. So that's kind of an important thing to realize. Now, could you have, somebody who has gastrointestinal issues? Could caffeine produce problems with that? Yes. So if you have an athlete who, say, has, reflux, maybe not the best thing for them to utilize for ergogenic purposes. So those are the things you want to look at. Understand the athlete's health history and the effects that it could possibly have. Because again, caffeine is a drug. So, like any other drug, there are potential negative effects. So you would want to educate them on that, and if they can tolerate it and they find benefits with it, it's certainly not not something inappropriate necessarily for them to use. So that sums up the information on your stimulants. Again, we primarily covered caffeine and ephedra with that. We'll probably talking even a little bit more about caffeine when we discuss nutritional supplements.